Being a nurse on the floor, have you ever noticed the blaring alarms and bells? All too often, nurses get overwhelmed and desensitized to these noises. It is not even a critical noise. It's like the boy who cried wolf. How many times can you go into a patient's room with IV alarms stating occlusion only because the patient has bent their arm? It's not an urgent issue, but one that needs to be fixed. And then you learn to not want to go back in because you're going in to have to tell the patient yet again to straighten their arm, until one time it really could be an emergent and you don't go in. This is the reason for the Alarm Fatigue Project. The purpose of this project is to evaluate the effectiveness of bundled alarm management interventions in reducing alarm fatigue and improving the satisfaction among nurses in acute and critical care settings. In registered nurses and other healthcare professionals working in an acute care hospital units, how does the use of bundled interventions that address alarm noise, standardization, proper ratios, education, staff feedback, compared to the usual alarm practices influence alarm fatigue and staff satisfaction? Alarm fatigue is the noise from IVs, O2 monitoring, BP monitoring, ventilator monitoring, bed and chair alarms. 80 to 90% of these alarms are non-actionable, meaning they are most likely positional and not true emergencies. The other 10 to 20% of these alarms are emergent and life-altering. Alarm fatigue has become such an issue, it has been made a Joint Commission National Patient Safety Goal. It is the belief that bundle interventions would improve workflow, reduce fake alarms, and higher staff engagement. Alarm fatigue increases the risk of burnout, desensitization, and missed alarms, and emotional exhaustion. Education and training increases knowledge and confidence with alarm management in nurses. Bundled interventions such as the ZEISS model reduce non-actionable alarms and increase alarm management. It has been found that education and training should be continuous. No standardized gaps identified in this project are no standardized definition of alarm fatigue, limited research with workload related contributions, and limited long-term studies. The results that were found is decrease alarm fatigue with alarm fatigue scale, decrease total and non-actionable alarms with the monitor log data, decrease nurse satisfaction and perceived safety culture with survey results, knowledge of alarm management with the post-education test scores, and increased compliance with standardized alarm practices. Alarm fatigue remains a critical issue in acute and critical care settings, compromising patient safety and staff well-being. Bundled interventions such as education, feedback, alarm adjustment, and noise reduction have proven most effective in reducing alarm fatigue. Using the Agree-To tool can help combine multiple strategies to achieve safer care and greater satisfaction. The recommendations are: implement a bundled approach with education, feedback, and alarm modification. Provide ongoing training and stimulation for all staff. Appoint alarm management champions to reinforce best practices. Engage leadership to support staffing resources and training time. Standardize metrics for consistency and future research. The overall goal is to improve patient safety, staff satisfaction, and promote a sustainable alarm management culture. Thank you.